In this podcast episode, Dr. Darshan Shah shares his deep expertise and forward-thinking perspectives on longevity, anti-aging, and cutting-edge medical innovations. As the medical director of Next Health, a pioneering clinic focused on regenerative and functional medicine, Dr. Shah offers an illuminating dive into therapeutic plasma exchange, stem cell therapies, and the broader state of longevity science. Throughout their conversation, they explore how emerging diagnostics, immune system optimization, and advancements in biologics are reshaping our understanding of aging and chronic disease management. Dr. Shah opens with a powerful message that genetics do not seal one's fate, even for serious conditions such as Alzheimer's disease. While possessing 2 copies of the APOE gene significantly increases risk, it does not dictate an inevitable outcome. Instead, lifestyle interventions, combined with early diagnostics and personalized treatments, can prevent or delay the onset of cognitive decline. The emergence of sophisticated tools such as brain volume imaging, particularly of the hippocampus, and blood biomarkers like the PAL217 protein, now allow for detection of Alzheimer's decades before symptoms manifest. These breakthroughs open a vital window for intervention, reinforcing the importance of proactive health management rather than reactive disease treatment. Central to Dr. Shah's approach is therapeutic plasma exchange, a procedure that has been FDA approved since the 1970s but is now being repurposed and recognized for its potential in longevity medicine. Originally designed to remove thickened plasma in rare conditions like Waldenstrom's disease, the procedure works by filtering out the plasma, the liquid portion of blood, and replacing it with sterile albumin. This process removes accumulated toxins, immune complexes, heavy metals, and other harmful substances circulating in the blood. Dr. Shah describes plasma exchange as giving the immune system a crucial break. The immune system, responsible not only for defending against external pathogens, but also for policing internal cellular health, can become chronically overburdened due to modern environmental toxin exposure, infections, and chronic inflammation. By clearing these toxic factors from the plasma exchange reduces immune fatigue, allowing it to better perform its role in eliminating senescent or zombie cells that accelerate aging and pathology. The procedure's regenerative effect is remarkable, with many patients reporting improved mental clarity, vitality, and skin appearance shortly after treatment. Dr. Shah also highlights the complementary role of therapeutic plasma exchange with chelation therapies, where mobilized heavy metals are removed more efficiently once they are in the bloodstream. Compared to other modalities like EbO2 ozone therapy, which uses ozone-induced oxidative stress to kill pathogens and stimulate cellular renewal, plasma exchange functions by physically removing toxic substances without oxidative damage. While both can be useful depending on the patient's condition, such as mold or Lyme disease versus heavy metal toxicity, plasma exchange offers a comprehensive filtration effect that detoxifies on a systemic level. The discussion expands into the realm of biologics, notably stem cells and exosomes, which represent the vanguard in regenerative therapies. Dr. Shah explains that stem cells can be sourced either autologously from the patient's body or allogenically from donated umbilical cord or placental tissue. Autologous stem cells are limited by the donor's patient's biological age and health status, which can affect efficacy, especially in patients with chronic disease or inflammation. Conversely, stem cells from young, healthy donors, in particular mesenchymal stem cells from umbilical or placental sources, offer greater regenerative potential due to their younger bioactivity. Dr. Shah stresses the importance of thorough screening and ethical sourcing in stem cell therapies, acknowledging risks such as contamination or infection if chain of custody and laboratory conditions are not rigorously maintained. He also sheds light on the emerging use of exosomes, the secreted vesicles from stem cells that carry growth factors, signaling molecules, and hyaluronic acid, tailored for targeted effects like skin rejuvenation, hair regrowth, or joint repair. Exosomes, typically less expensive than full stem cell treatments, provide a way to enhance healing without the complexity of whole cell therapies. Importantly, he notes that the success of regenerative biologics like stem cells and exosomes heavily depends on the recipient's internal milieu. Without addressing underlying inflammation, metabolic dysfunction, or microbiome imbalances, these advanced therapies may lack effectiveness. Hence, an optimal foundation of health, with appropriate lifestyle, detoxification, and metabolic support, is crucial before embarking on regenerative interventions. A recurrent theme is the immune system's pivotal role in aging. Dr. Shah articulates a concept they refer to as immuno-fatigue, wherein chronic environmental exposures to thousands of toxins present in food, air, and water, combined with rising infection rates and lifestyle-related stresses, overwhelm the immune surveillance mechanisms. This overload leads to accumulation of senescent cells and chronic inflammation, which in turn accelerates tissue dysfunction, cognitive decline, and the increasing incidence of cancers and chronic diseases, including in younger populations. The conversation brings attention to the fact that much of modern medicine focuses late in the disease trajectory, often intervening only when irreversible damage has occurred. By applying tools such as plasma exchange to alleviate immune burden and advancing early diagnostics, their clinic aims to interrupt this cascade much earlier. Gut health occupies a significant role in longevity medicine, as Dr. Shah emphasizes the importance of the gut barrier and microbiome in systemic immune regulation and metabolic health. Testing for markers such as serum zonulin reveals intestinal permeability, or leaky gut, a factor that can propagate systemic inflammation and exacerbate chronic conditions. Functional approaches involving targeted diets, elimination of gluten, dairy, processed foods, supplementation with collagen, glutamine, and probiotics, and slowing the introduction of beneficial bacteria lead to restoration of the gut lining and microbial balance. This, in turn, supports hormone regulation, such as endogenous GLP-1 production, nutrient absorption, and immune function. The episode underscores the revolution in diagnostics powered by artificial intelligence, big data, and advances in imaging and biomarker detection. Instead of waiting for symptoms or end-stage disease, Next Health and similar functional medicine practices are embracing preemptive strategies that allow clients to nip disease in the bud. Examples include imaging techniques to detect hippocampal shrinkage, blood tests to catch neurodegenerative disease biomarkers decades in advance, and circulating tumor cell identification for cancer at stage 0. While breakthrough technologies and biologics offer exciting prospects, Dr. Shah advocates strongly for prioritizing lifestyle and metabolic health foundations. Sleep, whole food nutrition, exercise, and effective recovery form the primary wheel of health optimization. Preventive medicine comes next, focusing on heart health, brain health, and immune system enhancement. His clinic's model then pursues functional medicine protocols, detoxification, hormonal optimization, microbiome repair, and mental health interventions to create an environment where advanced therapies like stem cells can achieve maximal benefit. Looking toward the future, Dr. Shah expresses optimism about the accelerating integration of AI and quantum computing into medical science. This includes advances like digital cellular twins, virtual models of human cells that can be used to screen drugs and peptides rapidly. Such innovation promises personalized, effective molecules that amplify natural healing with fewer side effects and at lower cost than conventional drugs. Peptides, as natural endogenous signaling molecules, represent a holy grail in medicine, able to restore tissue function and regulate biological processes in highly specific ways. Finally, the conversation touches on broader systemic issues surrounding healthcare delivery, economics, and incentives. Contrasting Western medicine's disease-centric, crisis-driven approach with more health-focused models seen in countries like Japan and Singapore, Dr. Shah and Gary highlight the importance of shifting toward prevention and wellness to control rising healthcare costs and improve population health. Dr. Darshan Shah's vision for longevity is holistic, integrating detoxification via plasma exchange, functional and regenerative medicine, stem cells and exosomes, rigorous diagnostics, and foundational lifestyle medicine. By empowering individuals to become CEOs of their health and leveraging emerging science and technology, his approach offers hope in reversing aging processes and preventing chronic diseases. For Dr. Shah, being the ultimate human means waking each day with vitality, positivity, and the ability to enjoy life fully with family and purpose. goals that advanced medicine is increasingly making achievable.